All right. Good afternoon, everyone. Welcome to our town hall. We'll be talking to you today about our affiliation with MultiCare. A couple housekeeping things for you to be aware of. We have turned off cameras and audio, the microphones to everyone. If you have a question, feel free to put it in the Q&A portion up on the top of the screen. At the end of the presentation, I've got Larissa and a couple folks that are supporting me here, and they'll start to consolidate those questions for us. So as we move along and you have a question, pop it into the chat for me, and I'll be more than happy to try to answer it at the end of the presentation. So today's agenda, as I talk to you about Samaritan, we're all Samaritan. You know, we have the opportunity here to lead the organization. Maybe I should introduce myself to you. Marty Cahill, CEO of Samaritan Health Services. And here's our agenda. So as I think about Samaritan, I think of all of us, all the people that are on the call, all of our 275,000 people in our 3-county region. So as we talk about Samaritan, it's a part of all of us. The challenges in healthcare, we'll talk about those. Partnership journey, what does partnership mean? The shared future. In the Q&A, we're listening. Again, unfortunately, the mics are turned off, but we will be reading your questions, and we'll be trying to answer all of your questions and comments as well. So I look forward to sharing this information with you today. So maybe what I should start out with, I want to start out with you today is the history of Samaritan, our story. And it's one of partnership and collaboration. If what we go back nearly 30 years ago, Lebanon Community Hospital and Good Sam in Corvallis were starting to sit down and talk about what a shared future could look like. 30 years ago, the headwinds in healthcare were strong. Being a smaller hospital did not seem like a viable position to be in. Cost of supplies, labor, kind of all the things we're facing today were we faced 30 years ago. And over about a year, Lebanon and Good Sam met and talked about what it would look like to collaborate and create a partnership. And out of that was the creation of Samaritan Health Services. About a year later, Albany joined the conversation. About a year after that, Lincoln City joined, and then Pacific and Newport joined. So within about 5 or 6 years, we had a 5-hospital system that again came together through collaboration and the belief that we're stronger together, and that the economies of scale would help with those headwinds back then. Maybe a little bit more about who Samaritan is now. We went from a 5-hospital system. We still are a 5-hospital system, nonprofit, integrated delivery model. We've got over 6,000 employees, 650 employed clinicians. And the 5 hospitals, we've got a level 2 trauma center. Albany's a community-based hospital, 3 critical access hospitals, over 80 clinics in our 3-county region. Health plan, which is very strategic. We'll talk more about that, but that's a very strategic component of our organization. We have our hospice house. We have the 2nd largest residency program in the state with 112 residents. And we've got Sam Fit in our fitness centers. So when we look at the headwinds in healthcare and the things that not only Samaritan, but I think every health hospital and healthcare system are facing today, we have rising costs, declining reimbursements. We've got increased cost of regulations. The regulatory world is very expensive for us. And then if you look at HR1, the decreased reimbursements to Medicare and Medicaid starting in 2027, those are not insignificant. It's nearly $1 trillion over a 10-year period. So those are the challenges and pressures we're facing today. And then we put that next to the expectations that not only we have at Samaritan, but the community has, and that's expanded services, more locations to receive care, modernized facilities, more clinicians than we currently have today, investments in tool and technology. Again, we want to continue to be cutting edge, modernized facilities. And so you take a look at the cost and the headwinds, and you take a look at the expectations of not only ourselves, but our community. There's an opportunity here for us to thrive, not just survive. So if we go back to about a year ago right now, Samaritan was having a pretty difficult year. We're about $60 million unfavorable to our budget. A bad year, not a catastrophic year by any means, but one that Doug Boycer, my predecessor, came to the senior leadership team and talked about was it time to go to market and see what opportunities existed for partnerships and affiliations. He then went to the board of directors. We all agreed that we should at least take a look at the market to see what was out there. You know, one bad year is one bad year, but if you put 2 or 3 or 4 of those bad years together, it could be catastrophic. And so we engaged a consultant, Juniper, to help us through this process. And they sat down, the leadership team and the board, and talked about partnership objectives. What are we looking for in a future partner if we were to to go forward? Mission alignment, culture is super important. I think we all understand that and have heard that culture trumps strategy. So we wanted to make sure that we were talking to organizations that aligned with us from both a mission and a cultural perspective. The next thing that we thought about was would an affiliation or partnership strengthen Samaritan's role in our 3-county region and in the state? We know that our reputation is strong, our brand is strong, and we wanted again to strengthen that in our county, 3-county region, and in the state. Would this help us expand access to care and maintain and increase the quality of care? Was a strong consideration. Keeping governance local, our SHS board, making sure that, again, the decisions made around the type of care that we deliver and the types of services we offer, again, having that local governance was going to be very important to not only us in the organization, but to, again, the 275,000 people we serve. And then the final part was the ability to secure capital for the future. So those were the objectives that we put out there, or we gave to Juniper. Juniper then put together a packet and sent out to market that a healthcare system in the state of Oregon was looking for an affiliation or a partnership. And if you're interested, please make them aware. And 38 potential partners responded to that request and asked for the information. But before Juniper would put that information out to any one of those 38, they would have to sign a non-disclosure agreement, confidentiality agreement, so that they could never talk about it was Samaritan Health Services that was interested in this. We didn't want that out in the market because we weren't sure what we were going to do. The other part of it is we would sign the same non-disclosure and confidentiality agreement about any partners. And so out of the 38, 18 organizations signed that non-disclosure. They heard about us. They were also given a packet to ask what the proposal would be around affiliation partnership. What did they view that to look like for their organization coming to Samaritan with a proposal? Out of the 18, we got 7 proposals back. The board of directors and the leadership team went through those 7. Narrowed it down to 4 finalists. Of the 4 finalists, we then requested more information from them. They requested more information from us. We then quickly narrowed that down to 2 finalists. The 2 finalists were invited to come to Corvallis, meet with the board of directors, meet with the senior leadership team, tour around some of our facilities, take a look at who we were. We then went to their facilities talked with their board of directors, talked with their senior leadership team, and toured some of their facilities. And at the end, it was unanimously decided by both the board of directors and the senior leadership team to choose MultiCare. And again, as you look at the partnership objectives, MultiCare nailed all 5 of those objectives, amongst other things. But that was really important that they met all of those. The other thing too, as I mentioned all this, and I go through it, the one thing I want people to understand is that we were viewed as a very strategic asset when we went to market. We always thought we were, but it was validated by going through this process. We had a number of proposals and a number of opportunities to look at. So again, we went from a position of strength, not from weakness. We were in a very good position to go to market. And I think one of the areas that really validates that for the board, our senior leadership team, and all of our staff is that not only did MultiCare want to affiliate with us, they also guaranteed a minimum of $700 million of capital investment in the first 10 years of our affiliation. So again, not only did they believe the culture was right and all of those objectives were met, they also believed that a $700 million investment in our area was what we needed, what we deserved, and they believed that it was in their best interest as well. So about a month ago, this picture here in the middle is myself and Bill Robertson. He's the CEO of MultiCare. About a month ago, we invited Bill and then Florence on the bottom right there. You'll see Florence with myself and Bill. She's the president of MultiCare. We invited them down to Lebanon to present to our joint managers, all of our leaders at Samaritan. And in the afternoon, we presented to all of our board members, our hospital boards, foundation boards, health plan boards, and such. So we had presentations all day. They came down. We signed the affiliation agreement there. The affiliation agreement is the contract that spells out what we both agreed to do as part of our affiliation. So that was the signing of that agreement. So it was a great day, a new chapter for all of our communities. And as we were in Lebanon and signing that agreement, before we did the presentations, as you go around the middle of this slide, on the top left, we've got Jennifer Kimberlane. She's the VP of Patient Care for our critical access hospitals, talking with Bill. Florence shaking hands to the right there. And as you go around on the bottom there, you'll see Bill and I and Florence in the garden over in Lebanon. It was just a great day. A lot of good, couple good presentations, a lot of good discussions that came out of it. And one of the things they were most impressed by is when they walked out of the Lebanon hospital that they really thought of it more as a community hospital, not a critical access hospital. The services provided, the size and scope of things that were going on there were very impressive. It was just a great day overall for us to present to MultiCare. On this slide here, you'll see on the upper left-hand corner, there's a black and white picture. That's the first hospital that MultiCare, that was created by MultiCare, and it goes back to 1882. Fanny Paddock came over on a covered wagon. They had a dream of creating a hospital that would serve the entire community. It wasn't based on race. It wasn't based on religion. They would take care of all of the community, anyone who needed care. And that was the dream that came about in 1882. So they're an organization that is founded in the Pacific Northwest. They're right here in our own backyard. And so that's really promising for us. And again, they understand the region and Oregon and Washington. And so if you go a little bit to the right there, you'll see in 1980, they were about a $45 million a year organization. And as you go across this timeline, you see the blue line that goes across up to the top right corner. What Bill talked about in his presentation was, if you take a look at what an organization does and where it spends its money and the things that it affiliates with and partners with will tell you what it truly values. It's kind of an eye chart, but you can see the partnerships and affiliations over the last 45 years, and they've grown from a hospital system of $45 million annually to 2025, it's going to be just shy of $7 billion. So again, they've been very successful in the state of Washington and their growth model over the last 25 years. This here's a picture of the pillars that MultiCare's board of directors uses at every one of their meetings. This is the lens they look at their day-to-day operations. If they're going to partner or affiliate with a hospital or healthcare system, they really believe that these four pillars should direct the way they think about and move forward in their day-to-day operations. And the first is the moral obligation to deliver the very best health to their communities, a healthcare system to their communities. They don't want to be a burden. They want to be additive wherever they go. And so their lens is always to can they offer the best delivery of health to the communities that they serve. The next is govern locally. They believe that's an essential part of what they do. Having headquarters in Tacoma, trying to understand what happens in Spokane and making the best decisions. They believe that, again, the leaders in each of the communities, in each of the hospitals, has the best lens and best experience to govern locally and make those decisions. The next is the trust of the communities. They want to build trust with the communities they serve. That's paramount to them. It's paramount to Samaritan as well. The first thing that they came down and talked to us about when we first met was the foundation for every one of their conversations and joint ventures and affiliations and partnerships is trust, and we felt the same way, and we trust them and they trust us. And then finally, again, a cultural transformation, customer and community centric. Again, that goes back to the govern locally. That's the patient at the center of the decision-making process and making sure that the patient, the customer, and the community are centric to the decisions that are made. The next part of it, when we looked at, I talk about culture, and we look at mission, visions, values. Across the top there, you'll see there's 7 values listed. There's 3 that are bolded: respect, integrity, and excellence. Those 3 that are bolded are 3 of the 5 values that we have at Samaritan. So the way that we go about conducting business, our lifeline, the way that we act, and very similar to the way that they do as well. And so that alignment was very obvious. It's just not words, but it's the actions that they take every day. The next, when you look at their mission, the first word in their mission is partnering, partnering for healing and a healthy future. They have the mission to want to partner. They want they don't believe that they know it all, they understand it all, and they can drive it all. They want to partner with each of the communities that they're a part of to again have that local governance and help drive those decisions, and a partnership and that we understand our communities and what they need, and they support us in doing it. So again, that partnering part of it was very obvious, and it's the way that Samaritan came together over our 5 hospital system. And then their vision will be to be the Pacific Northwest highest value system of health. They believe that's their vision for what they do, and they believe that Samaritan fits nicely into that vision, and as we do as well. So that, again, as we look at the alignment, it's very, very closely aligned. And then they have 3 strategies, but they're very encompassing. Their first strategy and the first lens that, again, when they look at what they do every day from a strategic perspective and when they affiliate, they want to expand access to care and services. And those are the things that we're struggling with here. We need more providers in primary care and some other services that we don't offer, like neurology ENT, dermatology. So again, there's services that we don't provide and access to care that we do provide. So again, those opportunities, those are strategies they're looking at, and those are the strategies we look at as well. Performance excellence, top decile performance, quality, and service. Again, that's our HRO journey, high reliability organization, reducing preventable harm. You can see top quartile on margin. They really do a great job of driving outcomes from a financial perspective as well. And then population health, innovative access, engaging our patients where they are, redesigning the business model. The business model today is somewhat perverse. We get paid when you come to the hospital or come to the clinic, usually to have something done. And so again, it's a fee for a service provided. And as we move forward, we've got to get more towards making sure that we help people with wellness and making sure that they don't come to the hospital. They don't have that catastrophic event. So again, the redesigning of that delivery model, the business model, population based care, again, opportunities that we've been looking at and working on, but they do a really good job there. So again, those strategies really align to the things we're working on as well. Maybe a little bit more about MultiCare. MultiCare is a 13 hospital system. They were a 5 hospital system about 13 years ago. Over the last 13 years, they've affiliated with 7 hospitals, and they've built an 8th one. And if you look up to the left corner there, Mary Bridge Children's Hospital. That hospital will open up in May. Mary Bridge Children's wing is at the Tacoma Hospital now, so it's a wing of that hospital. But they've been undergoing a construction of that building. It's about a $425 million facility. The part of trust and where we viewed it from a Samaritan perspective, that the community's trusted and valued them. They've been able to raise almost $100 million for this children's hospital. And again, it's a $400 million project. So again, a significant philanthropic campaign, which again, I believe really does validate the fact that the community trusts and believes in MultiCare and the care that they deliver. They also have the two behavioral hospitals in Washington. One is a joint venture, one they own. But with having those two hospitals, they have the largest footprint for behavioral health in the state of Washington. And what I mean by that is they take care of more behavioral health patients than any other provider in the state. So we believe that there's opportunity to partner with them in behavioral health services. They have 10 other acute care hospitals within the state, and they work. They have facilities in both urban and rural service areas. So they're familiar with what Washington and the service areas. Some of those areas are very similar to Oregon as well. This slide here is more about their vision of where they see themselves in the next 10 years. If you look at the bottom, the Pacific Northwest has just under 16 million people, and they view the Pacific Northwest as Alaska, Oregon, Washington, Montana, and parts of Idaho. And they believe that their vision is to take care of 1/3 of the population. Their goal is to have 5 million lives that MultiCare is taking care of and servicing. And so if you look across Washington, they go from Spokane to Tacoma up north. And then if you go down into Oregon, you see the Willamette Valley in blue. That's their first entry into the state. For them to get to the 5 million lives, they're going to have to enter Oregon in a more meaningful way. And they've been waiting for the right opportunity to do it. And they believe that Samaritan is that opportunity to be the foundational part of them growing their footprint in the state. They value, again, I mentioned our health plans. Out of all the affiliations they've done, they have not acquired a health plan yet. So they view that as a foundational piece as well to their population health platform. So we looked at the operating model for MultiCare, and they set themselves up very similarly to Samaritan. Uh, each of the hospitals had autonomy and in Samaritan, and when we look at MultiCare, each of their regions has the autonomy, high local autonomy. They again local governance at each of their regions, but they also have a corporately driven model too, where corporate services where there's economies of scale and expertise. They do that. They manage facilities really well, very similar to how Samaritan did it. So that hybrid model, empowering local decision making, again, that really resonated with our board and with our senior leadership team because it's very similar to how Samaritan currently runs. One of the other things too that we adopted from MultiCare is well, I think we thought of it this way, but they really nicely articulated it that when they look at whether they want to affiliate and what that looks like, it's a win-win-win model. And what the wins are is do the patients benefit from this? Does MultiCare believe that coming to and affiliating with another organization, will the patients be better if MultiCare becomes a part of that area? And we believe that they would, MultiCare and Samaritan. The next win is for Samaritan. Again, culturally and such, would it be a win for us? Because again, as a partner, if we viewed this as not as less than a win, again, the culture trumps strategy every day, and we agreed with the win for Samaritan as well as they did. And then does MultiCare win in this? Is there is there a part of this that when they come in, does MultiCare benefit and get a win out of this? And again, they do. We believe that they do as well. That you can see their vision over the Pacific Northwest. So this win-win-win methodology, patients, partners, and MultiCare, we adopt and believe in as well. So much like I had to bring to our board of directors and our leadership team brought to the board of directors and to ask for approval to move forward with the affiliation, Bill and Florence had to bring this to their board of directors and ask them, their board, to approve the affiliation. And we took this slide from them. We liked it. I think it speaks volumes to how MultiCare views Samaritan. The first is it's part of their strategy and vision as growth in Oregon, and they again believe that Samaritan is a great foundational piece for that growth. We're not viewed as just another piece or part of MultiCare. It's a strategic and intentional affiliation by both of us, and so again, they believe that this helps with their vision of growth in Oregon. It is a strong foundation to move forward in the state. To the right there, you see cultural alignment. I've been talking a lot about that, but they also believe that the cultural alignment and philosophies between the two organizations are strong. We live our values; they live their values. There was really not a lot of things, if any, that we didn't agree on. It was just really a very culturally aligned two organizations. Health plan operations. I mentioned they've done 7 affiliations over the last 13 years. They've never acquired a health plan, and they view that as strategic. That they just haven't acquired one because it hasn't been part of any of the last affiliations. But they view that as a very strong foundational piece for their population health model. So that was a piece of Samaritan that they don't have in their current organization. So again, a very strong strategic partner with high value for MultiCare, and health plans was a big part of that. And then finally, the MultiCare's strongest capabilities, that behavioral health model, that through hospitals, population health, to name a couple there, really those strong capabilities, they match up with our needs. We want to be stronger in behavioral health. We want to be better at population health, population-based care. So again, the alignments that they told their board about, we 100% agree with, and it's nice to see that how they explained us and their board approved and agreed with it. So future growth and opportunities here, yeah. So When we look at the $700 million over the next 10 years, there's some strategies and opportunities at a high level we've identified. We've still got a lot of work around creating the strategic plans and what the very first thing is going to be. But excuse me, if you look around our state, around our system, you can see that Newport and Lincoln City, new hospitals, Corvallis has a great emergency room. Lebanon has a beautiful emergency room. Albany has a nine room emergency department. They're the busiest. They see the most patients on an annual basis than any of our 5 hospitals. They only have 9 rooms. Unfortunately, they're landlocked where they are. They have 3 roads and a cemetery, so they can't grow in any direction. And all the space in the hospital is more than utilized. So the opportunity to create an off-campus emergency department or emergency room, would it be in North Albany, maybe out by Millersburg, some area where we could set up an off-campus emergency department. As you can see, it would be staffed and run just like an emergency room, X-ray, CT, lab, ED physicians, 10 to 12 rooms. They've set up 9 of these across Washington. They're very successful. They're part of the license of a hospital, so they're not freestanding. They're just an off-campus emergency room. We view that as a great opportunity for a place like Albany, where they don't have the ability to build out or grow more space within their facility or utilize more space. So again, off-campus emergency department, a great opportunity for a place like Albany. Indigo Urgent Cares, they have 49 locations across the state of Washington. Indigo, individuals on the go. They've got a nice marketing department. That's where they came up with Indigo. So it's that's where the name comes from. The interesting part of this, you can see 2 different clinics or urgent cares. The one thing nice about these urgent cares is that when they identify a space and sign a lease, within about 120 days, about 4 months, they're ready to be opened from a construction perspective. And the other interesting part of it that should help us is their ability to staff them right away. They just opened up the 49th one, and it's staffed and ready to go with providers and staff. So again, the ability for them to set these up. And if you were to look at a community like Philomath, we don't have a primary care clinic or an urgent care there. An Indigo Urgent Care would be fantastic in a place like Philomath. But I also believe that there's an opportunity to open a number of these around our 3-county region. But I think Philomath is a great example of where one of these could be set up pretty quickly and provide some services in that community. And as we talked about in their mission, partnering to expand ambulatory services. The one thing that Samaritan doesn't have today are ambulatory surgery centers. And as you look at insurance companies, outpatient surgeries, they're really pushing more and more to have safely and appropriately having surgeries done in outpatient surgery centers. And we know that it's an area of opportunity for us. We believe that there's an opportunity to build at least a couple of these in our 3-county region. We don't want to overbuild, but the idea of getting some ambulatory surgery centers to perform outpatient surgeries would be a benefit to our patients. And it's the way that the insurance companies are pushing those types of surgeries. So that's an opportunity for us in the near future. Telica, retail imaging. They've set up 3 of these retail imaging centers in Washington. They're testing the market. It's a cash pay model. If you walked in, you got an order to get an MRI or a CT. You can walk into this facility with your order. An MRI is $750, CT $500. You get your imaging done, and within 24 hours, you get the results back to your primary care physician. This model works well. They're testing this retail model. Folks with high deductibles, $5,000, $10,000 deductibles, shopping around where they get the cost. They know the cost. They come in, pay for it. It's part of that, maybe their insurance plan. People are becoming better consumers around our shoppers around these types of services. So they're testing them up in Washington, and we'll learn from that. If it's a successful model, the market is driving, that this is something that people want. I think there's an opportunity for us to potentially move into a retail imaging center somewhere in our three-county region. So then the other part of it too, when we look at this, areas for us as well, access to care. To the left there, you can see PT clinic, physical therapy, occupational clinics. Again, you can kind of see below there too, affiliated with MultiCare. Hold that thought, but I mean, if you look at that small branding there for MultiCare, more to come on that in a little bit. But the idea that they're partnering with providers in the communities, this is just an example that, again, Olympic Sport and Spine, an opportunity to create more outpatient physical therapy clinics in our three-county region, something we definitely need, and an opportunity that could happen, I think, pretty timely. And then to the right, you can see our service area, the coast to the Cascades. We're in need of primary care, behavioral health, pediatric clinicians. With or without MultiCare, we need those providers. But again, the ability to continue to seek and employ those providers, find them, and create better access in our three-county region. MultiCare is 100% committed to and believes that, again, access to care locally is super important. And so again, if we look at specialty areas, I've mentioned a couple: neurology, ENT, ears, nose, and throat, dermatology, just to name a few. But again, creating new services within our three-county region would be important, both Samaritan and MultiCare. So when we take a look at the continued partnership around in their communities, I mentioned the Children's Hospital. MultiCare has a Good Samaritan Hospital in Washington, so they'll have two through this affiliation. This one is in Puyallup. You can look at the left, the design of a new patient tower. To the right, you can see what it looks like. The interesting part of this tower, one is when they say that they're investing in the community, time and time again, we've found examples. When they say that they're going to do something, they actually do it. So that's a good takeaway from this. The other part of it too is that at Good Sam, we're going to need a new patient tower, a new patient wing, an expanded wing. There's a design flaw at Good Sam, and in that the sewer, the plumbing, the electrical, all of the utilities are buried within the foundation at Good Sam Hospital, and they then dive down below the boiler system there. That hospital is moving ever so slightly. It's not ever going to be uninhabitable, but all of those utilities are in a fixed conduit, and if they move some direction, we don't know which direction or how, potentially could be catastrophic for that hospital. And so when we look at a new central plant, if we were to build another wing at Good Sam, put a central utility plant in that wing like they did up in Puyallup, and we could get an additional 30 to 35 beds in that new wing, in addition to what we already have at Good Sam. A couple of things happen. We meet the needs of our community and the number of beds we'll need over the next 15 years. The other thing we get as well is we get a new central plant that fixes or rectifies that design flaw and allows us to continue using that hospital. So again, we can see the dollars invested is about a $400 million patient wing. It's probably going to be very similar, about a $300 to $400 million expanded wing at Corvallis. So again, the opportunity to fix the design flaw and create more beds, definitely an opportunity moving forward with MultiCare. MultiCare is looking to Samaritan again. They want us they want us to continue to be in that employer of choice category. And one might say, well, yeah, in the three-county region, you have the 5 hospitals, so you of course you're the employer of choice. But we have hospitals. We have a hospital in the north and a hospital in the south, and some people live here and work in those hospitals, but in those facilities. But really, when we look at the employer of choice, and you look at the longevity of our employees, we don't have employees that are around 1, 3, 5, 10 years. We have employees that work in all 5 of our hospitals with 15, 20, 30, 35 years of working at our facilities. And so again, and how do we maintain being the employer of choice? Again, trying to deliver the highest quality of care, the best employee patient experience, a great culture, and again, continuing to be the value system of health. Again, the MultiCare wants to be that. They view us as that in our 3-county region. I've talked to you about ambulatory network expansion. That's the EDs, the urgent cares, physical therapy. If you take a look at provider care network expansion, primary care, specialty care clinicians, they're 100% supportive and want us to continue and will help us to continue to invest in more clinicians. The acute care capacity, that's Good Sam, more beds there, an expanded wing to fix the issues. All of that to say, when we talk about all this growth and all these opportunities, the lens that MultiCare looked at all this through is this an economically viable partnership affiliation? And they believe that it is, and they view that it is, so much so that they guaranteed $700 million in the first 10 years. They value, as we do, keeping care local, being the system of choice. And what does the system of choice mean? When we look at being the system of choice, are people choosing to get their care at Samaritan? That would be this being the system of choice. Or are people coming to our emergency rooms in the back of an ambulance because it was the closest hospital? And that's not the case. So again, they want us to continue to be that system of choice. And all of this investment and affiliation with MultiCare takes us from a surviving mentality to a thriving mentality as a system. So when we look at this, we talked about how we came together 30 years ago. Um, us joining MultiCare is just the next evolution in the Samaritan story. Again, as I talked about, the local governance, they're a nonprofit organization just like we are. They deliver high quality care. So again, this is our next evolution. The one thing I do want to say here is that nothing changes today. I want you guys to hear that. We've got to get through a regulatory process with the state. We believe that's gonna take some time, probably 6 to 9 months. But nothing changes today. But we'll start talking about how to affiliate and what that looks like over the next 3 to 6 months. But if you look at how we came together as 5 independent hospitals 30 years ago, I don't think our board of directors, 25 years ago said we're done. I think they said we got to get to work and make sure that we go from 5 independent hospitals that get kind of a group purchasing cheaper things to an integrated delivery model with 650 clinicians, a medical group, and a health plan. So again, it's just the next evolution of Samaritan. So what's next? We've sent in our application to OHA, the Oregon Health Authority. We've got to go through the healthcare market oversight process. That'll take 6 to 9 months, but they have our contract, they have our application. That should be posted on their website anytime. It's due, today, early next week. They'll have that application out. And soon after that, our affiliation agreement, that contract that spells everything out, that will be on the website as well. So all that's done. We're going through that review process now. If you're looking for more information on our website, you can go to samaritan.org/affiliation. And then again, if you have questions, you can email us at affiliation@samhealth.org. I'll leave this slide up so you can write that down. But I will stop there for some questions and try to answer what I can.
Thank you, Marty. We've had a number of questions come in. I would say that the first main topic has been around insurance coverage. Can you tell us a little bit about how this affiliation will impact any of the plans that Samaritan is contracted with in 2026?
The very short answer is nothing changes in 2026 from an insurance plan perspective. Those have all been agreed to, designed months ago, so nothing changes for 2026. Uh, I will say that the middle of 2026, as we start to look at what we'll do in 2027, uh, those conversations will start up again in terms of what we'll do for 2027, but nothing changes. What we have today is what's going to happen for 2026.
Thank you. And then it appears that MultiCare takes United Healthcare as an insurance plan. Do you anticipate that Samaritan would take United in the future as a result of the affiliation?
Yeah, great question. I would say this, the synergies and benefits of being part of an organization like MultiCare and coming together is that it would be very difficult for patients to move from one hospital in Oregon to one hospital in Washington if they chose to do that. So having said that, the likelihood is to being part of a system, we would align very closely to the insurances they take. Uh, but we'll have to work through all that. But I would anticipate that over time we would have the same insurances or take the same insurances that MultiCare does.
Thank you. Will the slides and/or the recording of today's virtual community town hall be provided to those attending or to those who couldn't attend today?
I believe that we put the recording out on the website, so it's out there for people to hear. Yeah, we'll have one of them out there for sure on our Samaritan website.
Perfect. Thank you. Could you talk a little bit about how you see this affiliation benefiting Samaritan when it comes to recruitment and retention of clinicians?
Yeah. I think part of, when we look at um, Samaritan and MultiCare, the closest hospital to us is Tacoma. So from a distance perspective, um, that one would think that it would be probably pretty difficult to have any impact in Oregon. But when you look on the slide we had, they had 2,300 employed clinicians. They have three institutes: oncology, cardiology, and neuroscience. And so when we start looking at the number of specialties they have and the institutes they have, clinicians, when we have to hire not a large number of specialists in an area, the idea that they would have a, a group of clinicians that are part of the same organization where they could talk about cases and share cases and information, I believe that will strengthen our ability to recruit people to our region because they'll have the collegiality and tie back to specialists and other colleagues in MultiCare, those other 2,300 clinicians. And again, we have 650 clinicians, so we're talking about almost 3,000 clinicians. That's a really nice medical group and multi-specialty group that, again, they can share information, knowledge. So I believe that over time, MultiCare, being a part of MultiCare, that input and impact from that group will be very beneficial in the recruiting and retention of clinicians as we move forward.
Could you say a little bit about how transitioning from surviving to thriving and going into growth and expansion, do you see that having an impact on our ability to recruit as well?
Yeah, great. Another good question. When we look at, when we talk about, surviving, year in and year out, the Samaritan has generated about a 1% margin. And over the last 8 years, we've had to cut our expenses to match up with our revenue. We're still generating. Last year was a really difficult year. This year is a better year, but still challenging from a health plan perspective. So the idea of managing from day to day, kind of paycheck to paycheck, is difficult. The idea that we move towards an opportunity to start growing around again the ambulatory services is exciting. I think we have things to talk about with recruiting new people and new specialists to our community. And again, the idea that we're going to grow, we also got to be mindful that we don't have an open checkbook to do it. We're going to have to be very mindful of what we do. But I think the opportunity to talk to new clinicians and actually new employees and leadership coming that we have a plan to grow. We're sustainable and viable moving forward. And we're actually, doing things to increase access to care will definitely, it won't hurt us for sure. And I anticipate that it'll be a lot of good conversations around what that looks like.
You. Some comments around, in the recent years, the Corvallis Clinic was purchased by Optum. There has been some clinicians that have left that clinic since that time, which is compounding some of the access challenges we see in the market. Could you maybe speak a little bit about the differences that you see in this affiliation with Samaritan and MultiCare and that merger that occurred with Optum and Corvallis Clinic?
Yeah. Well, again, at first, I'm not intimately involved in Optum and Corvallis Clinic, but I think when we generally look at that acquisition for Optum, Optum is a for-profit organization. They have expectations to meet. You took a multi-specialty group that was self-employed. They were the owners, and you switch over to not being an owner. I think that made it difficult for some clinicians. I think that the model probably changed for those clinicians that were owners yesterday and employees today. When we take a look at Samaritan and MultiCare, we're a 5-hospital system that acts as a system. We've got our medical group, we've got all of the integrated delivery models, and moving to MultiCare, as I talked about their culture and the way that they've designed their organization, it's very similar to how we as Samaritan have done it for the last 30 years. So the idea that we're going to go from a not-for-profit healthcare system to a larger not-for-profit healthcare system that culturally aligns with who we are and how we do things. I think that again, it's going to be. I anticipate it being very but less impactful to our clinicians and our staff than maybe going from an ownership to an employee type perspective. So again, I think that the model for Samaritan doesn't change really at all, and the model at Corvallis Clinic completely changed.
Thank you. Oregon has historically been very low in the number of hospital beds available at any point. How do you see this affiliation impacting that?
Yeah, when I mentioned that as we do an expansion wing at a Good Sam in Corvallis, we want to add an additional 30 beds in that wing, as well as the utility central utility plant and some things there. But we went through an exhaustive review of all of our properties, and we did a master plan around that. And what we recognized is that the only state that is more underbedded than Oregon is Washington. So we've looked at it from our 3-county region, and we recognize that we're about, in the next 15 years, we're about 30 beds short of what we would need. And so the idea that we would add 30 beds in that wing in the next 5 to 7 years would cover what our region needs. But again, that's in our region, the state is still significantly underbedded, but we've got a really nice plan and an idea of what we need, and we'll build that into that expanded wing.
Very exciting. Some questions around, will the community have the opportunity to meet a MultiCare representative? Some questions around maybe why we don't have a representative from MultiCare on this call here today.
Yeah, great question. We right now trying to get our story out before the end of the year and making sure we're timely in explaining why Samaritan went out to market to look at an affiliation, see what the market had to bear. So this is us telling our story, but at the beginning of February, Bill and Florence will be down for 3 days. It's the first of many visits. We'll do some employee forums. We'll do some town halls. People will get to hear from Bill and Florence of their thoughts on MultiCare, their thoughts on Samaritan. So we'll have them down. And again, if you're not available during those town halls, it's the first of many engagements with them. They're super excited to get down. It's just trying to get calendars aligned, but we will all hear from them here in the first quarter of 26 and beyond.
Thank you. And so when we think about the 10-year, $700 million commitment, could you give us a little bit of a flavor of what will be the priorities in those initial years versus the latter years? And specifically, when do you think maybe some of the specialty services we don't offer today, when do you think we would be planning for some of that expansion?
All right. So just us talking here, there's no strategic plan set up around this yet. But I think in the first 5 years, over the 10 years, I think we can break it up in the first 5 years, second 5 years. I think specialties we don't have are probably a short-term plan in the first 5 years. Off-campus ED, first 5 years. Urgent cares, first 5 years. Anything around access, we'll probably handle very quickly. Primary care access, specialty access, all of that will happen, I hope, very quickly and very timely. The second half, that expansion at Corvallis Hospital, a Good Sam Hospital, that's probably the second half, the second 5 years, and that's probably going to be $300 to $400 million. So that piece will come. That's probably the second half of the commitment. But I think that again, the areas that we can move quickly in are creating better access, and more specialties that we don't currently have. So that's how I would phrase it. Larissa's our VP of strategy, so maybe she might have some other thoughts on it as well. I'll give her a chance to respond as well.
Thank you. I think I agree with you. I believe that the top priority that we've been discussing with MultiCare through this process is how can we expand access? How can we bring new services to the community and more robust services? I think that also ties into a question that I saw come in the chat around some of the challenges that are being experienced currently in the Valley for obstetric care, and especially with some local clinicians, non-employed clinicians leaving their practice. Haven't heard about that specifically here today. Do you want to spend just a minute talking about what we're doing and if there's a plan for Samaritan to expand obstetric care as a result?
Yeah. There's some really there are service lines that unfortunately there are not enough clinicians in the country to hire. Obstetrics is one. And so when we look at that, my understanding is there might be some clinicians not associated with Samaritan that are leaving. I think anyone in the community who's leaving, we would be interested in talking to. I think the one thing I would say too is that when we look at the cultural alignment between MultiCare and Samaritan, we just have to make sure that as we move forward, any new hire that we make sure that it's culturally aligned as well, that they view the delivery of care the same way we do. But we always are interested in trying to hire as many clinicians as we can. The unfortunate part about obstetrics as well is that when we have 2 or 3 people that leave the community for another opportunity, it's not easily replaceable. We just can't go out and find docs to replace them quickly. We've had 4 OBGYN positions posted for the Valley for over a year. And so, we hire one and then one leaves. We hire another one and one leaves, and then one leaves, and we're trying to chase after it. And so right now, we're committed to securing obstetrics in all 3 communities. Having said that, when we have no OBGYNs in a community, we've got to work together with our medical group to provide the safest, best care we can while also potentially having patients have to have care in another community while we secure the clinicians we need to create a program that's safe for our patients moving forward. And so we're working towards that. We're committed to obstetrics. We're just going through a period of time where we just don't have enough clinicians at both the valley and the coast. So we're piecing it together, and the number one component of piecing it together is to create the safest program we can, and then expand that safe program back to all three communities again.
Thank you. And I see we've gone a little over time. We're down to our last three questions.
Okay.
And so I'll try to work through those here. Can you talk a little bit about MultiCare is making a significant investment in Samaritan as a result of this affiliation? What does MultiCare get as a result of that investment?
Yeah, a great question. That is when you look at that investment, the opportunity for some MultiCare to grow in the Pacific Northwest. They've been waiting for the right opportunity. They've been very intentional in their growth strategy. Again, if we looked, as we talked about, all of the alignments around mission, values, strength in the community, high value healthcare system, that they get us. I mean, and I say that not as an arrogant statement, but as a confident statement that we have a health plan. They don't have a health plan. We have 3 critical access hospitals. They don't have a critical access hospital. As you look at rural medicine and rural healthcare delivery in Oregon, there's 33 small hospitals. So if they're going to grow in Oregon, that's going to be part of the strategy, I believe. And so we bring that expertise across the state of Washington. They have 40 residency spots across their 13 hospitals. We have 112 residents in Kitsam, so that residency part of it as well. So our integrated delivery model is really intriguing to them. With the 3 county partnerships that we have with the county health, with our county commissioners, with our local leaders. Again, all of those things they're really impressed by. We have done things in ways that they have not been able to, and so they believe that there's a lot to learn from us. And the fact that again that we've been together 25 years and act like a system, we are a system. They believe that there's a lot of learnings from Samaritan as well. So much so that they committed and guaranteed that $700 million to our region in the first 10 years. The other part of it too, which I don't think I stated, is that if we perform really well and we do greater than $700 million, they'll reinvest those dollars back into our 3 community area as well. So again, they looked at it from a viability perspective as well as a cultural perspective, and they very much view it as an investment, not a handout.
Thank you. With Samaritan payer mix being predominantly government payers, and MultiCare also being a large provider to government payers as well, how do you see the challenges with upcoming cuts in the Medicaid reimbursement through HR 1 impacting this merger? And maybe more specifically, what role do you see the population health expertise of MultiCare playing, and how we could plan for and address those challenges?
Yeah, when we look at delivery, just generally the delivery of care in the country today, it's almost perverse in nature. If something bad happens, we get paid. So again, the move to population health is to get upstream, to start to meet people where they are, start to create opportunities for them to be well. We have Sam Fits and things of that nature. But again, the idea, and the other part of how the system works today is that you have to go to a doctor we can get paid. You have to have an order to go see a physical therapist or a very clinician, someone who's credentialed to do something very specific. And the population health model is that again, we get you to Might be a social worker who has the network of services in the community that could help them. It could be any number of folks that we get paid per member per month for the care that we deliver, and then we deliver it in the best possible way, and then we're held accountable to the outcomes too. So the model today more so is try to meet people where they are. Try not to have them end up in the emergency room. Try not to have them end up in the hospital, but meet them upstream so that when there's again, there's not a catastrophic event that could have been prevented through some preventative measures and access to care. So increasing access to care and also providing services through the cost or the what we receive to take care of patients. Those are all areas of opportunity for us to again try to avoid those catastrophic events and hopefully not have one, or hopefully they're not nearly as catastrophic or significant downstream.
Thank you. And then our final question for today, talk a little bit more about the governance structure post-affiliation, ultimate authority, who has the ultimate decision-making authority, and also if it is just Samaritan and MultiCare, or if there are additional entities involved in this affiliation.
No, so the ultimate decision maker is MultiCare. I'll just cut the right there. They and when we look at this, it's a they call it a member substitution. In a not-for-profit organization, there's a sole member, or there's a member. Our member right now is Samaritan Health Services. Post-affiliation, it will be MultiCare. So MultiCare will have the ultimate decision-making power. But when we look at that overall, we'll have our SHS board, there'll be the regional board here. They will oversee, direct and guide the budgeting process like they do now. The hiring of my role, the CEO, they'll have input across all of the areas that they currently have. The one final piece though is that it will be sent up to MultiCare for their final approval. And I'll equate it to each of our 5 hospitals does their budget. That budget is viewed by their hospital board, then it goes up to the SHS board. So again, the alignment of how Samaritan is will very much align as a region up to MultiCare. Our SHS board will oversee and make recommendations. And I find it generally will be hard to believe that MultiCare won't be asking for and looking for the recommendations from our SHS board up to MultiCare, because they're the closest to what happens in this region. So, but the short answer is MultiCare will be the sole member of our organization, and they will have the final say in what we do.
Thank you very much. We've answered all the questions, so thank you.
All right. Thank you all for attending. If you have any other questions, feel free to email me at any time. I'll be happy to, I'll get back to you as timely as I can. Thank you.